Thanks for staying with us. The DA says Cabinet's approval of the National Health Insurance Bill in its current form is premature and irresponsible. The bill was tabled in Parliament after getting the green light from ministers on Thursday. In fact, it will be tabled in Parliament after getting that green light from the ministers on Thursday. It means to realise universal health coverage. That's the intention in South Africa. Now, if it is passed, government says it will roll out the health insurance in phases. The DA Siviwe Kwahobe joins us now from our Cape Town studio to talk about this. A very good morning to you, Siviwe, and thank you for your time. So, the National Health Insurance aims, of course, to provide the best quality health care for both rich and poor in South Africa. Why are you so opposed to what appears to be a very noble intention?
Noble indeed, Tembegile, but I think it's quite important to understand that there's a difference between the legislation that the government is now proposing and the need to move towards universal health care. So as the DA, we're in full support of the idea that there are deep inequalities when it comes to access to health in this country, and we definitely need to move towards universal health care. But what we're opposed to is the bill that we have seen in the Fifth Parliament, which we are now going to obviously interrogate in the Sixth Parliament, because there are deep problems within that bill. One of them is the fact that there is no emphasis on improving the current health system. All that it focuses on, it just simply focuses on simply leveling out the field of access. Also, number two, the previous minister, Dr. Aaron Motsoaledi, said that it would initially, in its initial phase, cost the taxpayer 259 billion rand, and then later admitted that in fact that was a thumbsuck, and they quite frankly didn't know. So we don't know what the funding model is. We don't know where this money is going to come from. And then thirdly, which is our biggest problem, is that this bill in its current form would seek to establish yet another state-owned enterprise. In Tembegile, we are absolutely opposed to that, because as we know, South Africans, there are state-owned enterprises right now that we have to bail out, and we cannot have a situation where health is in the hands of the politically connected few.
And one of the things that you have said is that if this bill in its current form were to be approved to go ahead as the NHI, the country's NHI final plan, it would create what you say is the perfect breeding ground for mass corruption and slow delivery of care. Why do you believe that to be the case?
So, absolutely. So, what this bill would seek to do, as you understand, provincial departments are the implementing agents of health. So, what this bill now seeks to do, it seeks to centralize healthcare at the level of national government. So already we're going to have a problem where there is over-centralization and there's going to be slow delivery of care in that sense. But also, when we're talking about the danger of corruption, we have seen with a number of state-owned enterprises under the ANC government, from Eskom to Denel, and now as we're seeing in the Zondo Commission, all of these things coming out, that state-owned enterprises in the past 25 years under the ANC government have in fact been used as a looting scheme. So what we don't want is a situation where there's a central fund of billions managed by politicians at a national level, where there's no proper oversight, because we don't know how this fund will be managed, and then there are no proper checks and balances, and then we have a situation where there will be rampant corruption, and then the people are going to suffer at the end of the day.
You've got an alternative that you are proposing, a bill that you say, if we were to adopt as a country, would proceed over an 8-year period, would be funded through tax reforms. How would that impact you and I in reality?
Absolutely. So one of our biggest also problems with the current bill is that the timelines are absolutely unrealistic. So the current NHI bill talks about implementation within 15 years or so, and we are saying that universal health care does not have to wait for 15 years. We could implement universal health care within 5 to 8 years. So how we would do that in terms of funding is that we would be able to deliver this health service within the current health budget. So we wouldn't need an additional 259 billion or whatever the money is. So we would be able able to deliver the healthcare within the current budget envelope by doing the following. We would be able to retract money from the tax benefits that is afforded to medical aid clients immediately. That affords us 17 billion rand, which would be able to go back into the system. We would then be able to invest that money in primary health care, which is where 80% of care should really be happening, in clinics and day hospitals in our communities. So we would invest in that. We would invest in maternal and child health and in emergency services. And so what we are saying is that we can be able to deliver this universal health care without an additional budget allocation by simply using this tax benefit and establishing a health justice fund. And we wouldn't necessarily start a state-owned enterprise. Provincial departments would still be responsible for the rollout of health care, but then there would be greater consequence management from a national level to make sure that provincial departments are doing what they're meant to be doing. So what we're simply saying is that this is expensive, this is going to open itself up for corruption, and it's actually not going to benefit the people at home, the people who are depending on this health system, because it's not going to improve the current health care that they're receiving, and it's not really going to materially change their lives. So that's why we're proposing alternatives.
Right, Severe Kwahube from the Democratic Alliance, thank you so much for your time this morning. Well, it's been a disappointing week for South Africa, to say the least, in sport, but one team